Fantastic. Excellent. So moving on in our program, we wanted to highlight environmental health disparities and environmental justice issues that are facing our nation and our region, and also in the local setting. And to facilitate and moderate our next session, which is a panel of wonderful speakers, Dr. Danielle Stevens-Watkins is going to be the moderator. So I'll introduce her and then turn it over to her and the esteemed panel. Dr. Stevens-Watkins she received a Ph.D. in counseling psychology from the University of Kentucky. She also has her master's in clinical psych from Spalding University. She is now the Assistant Vice President for Research in Diversity and Inclusion here at UK, and she leads our Unite Research Priority Area. She has been funded by NIEHS for decades and has research focusing on health disparities and barriers to service and utilization among African American populations. So Danielle, we are very glad to have you as part of this event, and the panel is yours.
Good afternoon, everyone. Thank you so much for joining us. I have the pleasure to introduce our three panelists for this afternoon panel session. I will start with our first panelist, Heather Henry. Heather Henry is a program officer with the Superfund research program at the National Institute of Environmental Health Science, located in the Research Triangle Park in North Carolina. At NIEHS, Heather manages research grant programs, including university grants and small business grants, with topics ranging from toxicology, environmental cleanup, community engagement, COVID-19, and disaster response research. Heather is a member of the NIEHS Environmental Health Disparities and Environmental Justice faculty and is involved in several efforts to promote diversity, equity, and inclusion at NIEHS. We are so fortunate to have Heather this afternoon. Thank you, and I wanted to introduce Heather.
Thank you, Danielle, and thank you so much, Erin, for the invitation to talk here today, and very much enjoyed the prior presentation by Dr. Frumpkin. I'm going to be talking about the national perspective, or a national perspective, regarding environmental health disparities, and I'm going to be taking an attack talking about research, legislation, as well as coordination. So I thought I'd start out with some definitions. A health disparity is a health difference closely linked to social, economic, and or environmental disadvantages. So when it comes to an environmental health disparity, these are disparities resulting from stressors, including environmental exposures, exposures that might be related to natural or man-made disasters. And these disparities amplify or increase existing health disparities in vulnerable communities. And by vulnerable communities, we tend to notice that these are communities experiencing lower SES, closer to pollution, limited health care, maybe experiencing a lifetime burden of multiple exposures, as well as limited literacy. Environmental justice goes alongside with environmental health disparity and is sort of an aspirational goal to achieve a fair treatment and meaningful involvement of people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And I think it's important to note that when it comes to environmental health disparities, a majority falls on low-income, minority, tribal, and indigenous communities. They're more likely to be bearing the environmental insults that are involved with environmental health disparities. So I'm going to start by giving a context of what's happening at NIEHS. We're not the only institute from the National Institutes of Health that is working on environmental health disparities, but certainly the work that is being done at NIEHS is illustrative of other efforts. And it's a very important aspect of our own strategic plan to uncover and understand these social determinants of health, as well as promote environmental justice. So I'll start with research that's happening at NIEHS. Those of you may know we're located in Research Triangle Park, North Carolina, and we have several scientists working there in laboratories and running contracts. As it pertains to environmental health disparities, the National Toxicology Program does several toxicity testing related to chemicals that might be associated with ethnic personal care products, diseases that are more common among minorities, or pesticides in migrant workers. We have an active epidemiology group working in several communities looking at environmental justice issues. And we also sponsor community forums with our director, Rick Wojcik, and then have coordination efforts for groups that relate to environmental health disparities, such as disaster research, as well as environmental global health. And NIEHS is also involved with COVID activities that are at the NIH level. And as it relates to environmental health disparities, there are two programs that work directly with underserved populations. And NIEHS has a management role for some of those. RADx Up is a testing strategy for underserved populations, and RADx-RAD is a wastewater surveillance means to assess COVID in communities. But I'm going to turn gears now and talk more about the work that NIEHS is funding. And we have a program for environmental health disparities that look at basic and epidemiological as well as social scientific factors that explain the burden of disease in lower socioeconomic populations. Partnerships for Environmental Public Health has a research to action program. This highlights the importance of community engaged research. The worker training program provides work skills to impacted communities. The Superfund research program is an example of the multidisciplinary research that Dr. Frumkin was talking about, and it has a systems approach to problem solving. And then lastly, we have a time-sensitive research grant program, which enables small grants encouraging partnerships between researchers and disaster-affected communities, many of whom are some of the vulnerable communities that I was mentioning previously. So just to give an example of one of the environmental health disparities research centers, this feature is on MADRES, which is a maternal and development risks from environmental and social stressors. This center is out of the University of Southern California and focuses in on low-income Hispanic women in Los Angeles area. And just want to point out some recent work that they've done mapping COVID case rate pollution in public transit and housing density. And just to make one little take-home message here that this type of work, this type of interaction with communities has really enabled the community outreach to let the MADRES families know more about COVID susceptibility. And the research to action, again, this is a program that really focuses in on community partnerships. And I'm mentioning just two of them here. They're both relevant to Kentucky. The Mountain Air Project focuses on disparities in Appalachian communities with regard to respiratory health. And a recent program is one looking at disinfection byproducts also in the Appalachian area. And again, in terms of another take-home message, just how important it is to engage communities in research, especially the type of research that NIEHS is doing. Not only does this help build capacity, but there is evidence that it improves intervention success. And I want to point out that the Partnerships in Environmental Public Health also has a vibrant podcast system, and they had a recent feature on another Kentucky example. This is out of Louisville. The Green Heart Study looks to examine the impacts of green neighborhoods on heart health. And this type of intervention, I think, also points to another take-home message, is just sustainable solutions. So this work is based on rigorous science. The solution itself really gives back to the community through creating additional green space. And talking about giving back to the community, the Worker Education and Training Program has had a long-standing interaction in training low-income minority communities who are in communities that are impacted by hazardous substances. So through providing job training, it has really raised the capacity not only of individuals but also their families by giving them additional livelihoods. The recent work that has been undertaken by the Worker Training Program is to fund specifically COVID-19 essential worker training. And so just to again make another take-home message about job training and how this activity not only advances cleanup, but also improves the livelihood of individuals and families. And the Superfund research program, this is the program for which I am a part. And as mentioned before, this is a highly multidisciplinary research program. So it has biomedical, environmental, engineering research, research translation, community engagement, a very important cross-sectoral training. So training the next generation to know how to converse with many different sectors. And then data transparency and integration is also an important part of these centers. So a lot going on in these centers, and maybe a point I just wanted to make relevant to environmental health disparities and environmental justice is something that the SRP is moving towards as part of our new strategic plan. That's a systems approach, and a systems approach at its best means inviting multiple perspectives to the table to understand a full system in which a problem exists, allowing you to possibly find many solutions in multiple sectors. And, you know, taking the point home just a little bit more, you know, as being a part of the National Institute of Health, of course, we're very interested in health disparities and biomedical issues and dysfunctions. And in some cases, solutions are found through biomedical interventions, such as pharmaceuticals. But, you know, in many cases, you know, we're finding that it's not always a biomedical solution. There may be several non-biomedical solutions. And I don't think the Superfund research program is the only one doing this. I think the groups that I've talked about prior to this are also showing how sustainable solutions can be really broad for improving health. Again, having interventions that are based on science, identifying multiple ways to reduce exposures. That allows you to tailor interventions to the community, make sure that it is in keeping with economic and other practical concerns. And as mentioned in the prior presentation, you can address one problem by bringing a solution to other problems. So you can give back to the community and in some cases address other issues of inequity. Just briefly wanted to touch on some ongoing work within the centers and make the point about how important it is to communicate risk and make informed decisions. You know, there's work at the University of Kentucky on diet and health. Northeastern University is working with the population in Puerto Rico about risk uncertainty for several contaminants that are found in the study population. Water testing, water treatment, and healthy fishing are also ways that our grantees are bringing science and helping individuals make personal choices to reduce exposures. And then stepping onto a larger scale, communities making informed decisions. Having communities at the table for remediation decisions is very important, and the role of our university centers to help broker an understanding of the implications of some remediation efforts, such as PFAS incineration and dredging. This is really important to communities to feel confident that the solution is not causing additional problems to their community. And with climate and extreme weather events, there's also tremendous opportunity to understand and try to suggest better urban planning to prevent some of the vulnerabilities of communities who are impacted by extreme weather events. And that's a good segue to talking about other national efforts on the horizon, being that climate change, the executive order recently released, has several provisions for environmental justice. So Justice 40 is an initiative originating from a grassroots effort, but now as a part of the executive order. That calls for an investment of 40% of federal activities for climate change to go to disadvantaged communities. In addition, they'll be ramping up mapping screening tools to make it easier to identify vulnerable communities in a climate and environmental justice perspective. And the executive order also calls for the establishment of a White House Environmental Justice Advisory Committee. Their next meeting is April 28th, so it might be interesting for those who attend. Of course, it's virtual, and you're able to participate that way. And also, the COVID stimulus package included $100 million in funding for environmental justice grants, as well as grants to state and local governments to reduce air pollution in marginalized communities. I just want to talk about the Department of Health and Human Services, a couple of other activities. The ATSDR just released a community stress resource center. And this is a tool for helping communities understand how they can reduce stress and build resilience, especially as it relates to environmental contamination. And also want to mention Healthy People 2020. This is an excellent resource for understanding health disparities through time. It pulls together resources from several databases so you can actually see and measure how ethnicity and several other socioeconomic factors impact a disease outcome. And related to that is Healthy People 2030, which sets goals for the future for reducing health disparities. And among those goals are several that relate directly to environmental health disparities. Here's an example of homes with safe water. Lots going on in the federal level, and so coordination is very important. And the Interagency Working Group on Environmental Justice is that group that helps pull together and coordinate activities that are happening. Great resource for funding opportunities and events related to environmental justice. And more recently, they held a series of town halls on COVID and natural disasters and underserved communities. And I believe the report is due out in August. EPA has several environmental justice resources. They award grants. They have a screening tool that I mentioned previously. It's going to be a part of the climate change package. And then they also have reports on successes in EJ communities. And finally, the National Environmental Justice Advisory Council is a group that informs the EPA, and it's coordinated by them, and they also have public meetings. So that was a real whirlwind of national activities. National Institute of Environmental Health Sciences, I think, gives an idea of the type of work that is ongoing in the federal government. Basic to applied, data-driven research, community-based interventions, building capacity, creating value within a community, and taking a systems approach to solving problems. The White House initiatives, as well as accompanying legislation, I think is an indication that we'll be seeing more and more of an emphasis on environmental health disparities and environmental justice. And with that, this builds on several excellent resources and products out of the Department of Health and Human Services, as well as the Environmental Protection Agency. And then again, just to point back to that kind of overarching idea that, you know, we can look towards sustainable solutions to really improve the health in vulnerable communities, not only based on understanding of exposures, but helping people make good personal choices, helping communities make good decisions about remediation and urban planning, and then also be ready for those surprise events that come up that we don't expect, like COVID-19 and other climate change issues. And so with that, I want to point to you towards a request for information that is out and due tomorrow for the NIEHS, inviting comments and suggestions to advance and strengthen racial equity, diversity, and inclusion in the biomedical research workforce and advance health disparities and health equity research. I also have posted on this webinar format a document that has a list of funding opportunities and other resources, some of which are listed here. And so I'd like to thank you as an audience, thank the organizers, and a big thanks to the real environmental health disparity and environmental justice experts at NIEHS who provided some help to me in putting this slide together. So thank you. Back to you, Danielle.
Thank you so much, Heather, for presenting. If you all could keep your questions to the end, and we're going to present those questions to our panelists at the end of our last presentation. So please make sure you document your questions in the Q&A box, and I will be revisiting that box at the end of our panel. Our second presenter is Amanda LeFevre. She is the Deputy Commissioner of the Department for Environmental Protection. Amanda serves as the Deputy Commissioner, and she previously served as the Director of the Division of Compliance Assistance, DCA. She specializes in enhancing the educational offerings in DCA and its programs, which includes compliance assistance, brownfields, and the state's environmental leadership program, KY Excel. She serves as the chair of the Association of the State and Territorial Solid Waste Management Officials, Brownfield Focus Group, and the vice chair of the CERCLA and Brownfield Subcommittee. Amanda earned a bachelor's degree from Brusca University and a master's degree in public administration from the University of Kentucky. Amanda is a Kentucky native, originally from Falls Rough, Kentucky. Welcome, Amanda. Thank you.
Thank you so much, and thank you for having me here today with such wonderful speakers. I'm honored, and I just want to talk to you a little bit today about our work within environmental justice within the Energy and Environment Cabinet, and how we're trying to advance environmental justice and community engagement in order to, help address those disparities, health, education, and economic disparities that we have in our communities. So, and my cat decided to take make an appearance today, so apologies. But the thing about EJ is it's been a part of my career within Department for Environmental Protection since day one. I've been with the Brownfields program most of my career, and if you're familiar with Brownfields, that is basically working with communities to assess and remediate properties that are contaminated or thought to be contaminated. So it's your urban blight, it's your rural areas where factories have gone out, it's anything from dry cleaners to mine-scarred lands to old factories and everything in between. So I've spent my career with environmental justice because it goes hand in hand with brownfields and what we do, because we work directly with communities to redevelop these properties and get them back into reuse. And that could be anything from an urban garden to a new business that might provide jobs to social engagement opportunities. So it can be whatever that community wants, and those are the best redevelopments, is when you can work directly with the community, and it's a community decision of what that redevelopment is. So, like I said, I've seen it all. I've worked in urban settings and rural settings. I've seen environmental justice, in terms of income and race. I've worked with coal communities, with the ebbs and flows of that industry, as well as other industries. If you go to west side of Louisville, you could see everything from chemical factories to everything else. So, it's a little bit of everything, but the impacts are universal. These are the communities that have issues with safe and reliable drinking water, a la Martin County, which we're working with really closely right now. Places have issues with access to food. The local convenience store should not be your main source of food, when you can. Healthy fruits and vegetables are really what keep you healthy, not only weight-wise, but cancer risks and everything like that. You may not have access to healthcare in these communities, and of course there's fewer opportunities for jobs, so you can either move up, move out, or stay in your neighborhood and advance it. So there's certainly challenges, and so environmental justice is near and dear to my heart, and with my particular job at DEP, it's very part and parcel to it. And, so I've seen a little bit of everything, but I will tell you the one thing that really was an aha moment for me, and I think part of our challenge in DEP when we're talking about a new environmental justice framework, which I'll get to here in a minute, is giving all of our employees that aha moment that really brings it home to them. But early in my career, I was in the west end of Louisville at a community health and safety fair. And there was a mascot there. He's really, really brightly colored. I'd never seen him before. I grew up with Louis the Lightning Bug and, things like that. But I'd never seen him before. I went over to the booth, and he was Wally the Shelter-in-Place Turtle. And he teaches kids about sheltering in place when there's some sort of environmental emergency, chemical spill, something like that. And apparently he was originated in a lot of the bands where there are all the chemical industries in the South. But it was that moment where, even though I had grown up, somewhere between middle class and poor, and we had, issues with, bills and stuff like that, I had never really had to think about that part of safety for me. What is it like growing up where that is necessary, where you have to have a mascot to teach you about sheltering in place? So that was a weird little aha moment, and it's really stuck with me. So, but what we really need is that for our other cabinet employees, because we have people who do permit applications. Well, that's mostly calculations and things like that. That may not be out and about in the public, but we want all of our employees to really understand that everything that we do at the cabinet has some sort of environmental health impact to someone somewhere. So we are undergoing a process where we're trying to really ramp up our environmental justice efforts and how we do business here within the cabinet. So just a little background, of course, environmental justice is born of the civil rights movement, and specifically there's some key events, the Memphis sanitation strike and the Warren County PCB landfill that really sort of kicked off the environmental justice movement. And that gave way to executive order in 1994 under the Clinton administration that really made the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, part of the federal landscape. It's that environmental justice goal there. So and as they've had to implement it, of course it applies to all the federal programs. We are a designated state. We enforce these federal programs. So the Clean Air Act, Safe Drinking Water Act, RCRA, all of that we inherit from the federal agencies. So we automatically, have to, implement and internalize those environmental justice frameworks, and we have. I mean, we do open meetings, and we do, public notification for permit applications and things like that. But there's also that, want to do more, and I think that. The Beshear administration came in, and I think one of the first few things over the last summer is we realized that we needed to look at our environmental justice framework and what we're doing, and we proposed a new one. So this is something that we're currently rolling out. We actually just started it, but it's an effort to really make our efforts more fruitful and be more engaging with the public and with our communities when it comes to environmental decision making. So what we really want to do is raise awareness of EJ within EEC, some of those aha moments like I was talking about. We want to really work on effective community engagement and involvement. And not just passive notification, and really work at communicating information better to folks. There's a lot of agency program evaluation that we need to do, and integration of EJ into different decision points. And of course, training internally and externally, and also using some of the resources that were mentioned in the last presentation. There's lots of good things out there for us to use and for us to communicate with and for us to decision make with. So it's really sort of internalizing all of that stuff and making it part of our everyday business practices. So the first thing I want to talk about is a little bit is community engagement. We as a regulatory agency, we follow the letter of the law. So there's certain things we can and can't do. But we do know that we can build relationships with EJ communities. So some of the things that we can't do, we can work with our partners. So we really want to work on building relationships with those organizations that are grassroots, that really impact, communities at the ground level. We want to provide training and educational materials to people. If you've ever read an environmental permit, they're not so easy to read. Sometimes, we have very, very technical documents. So, working on materials so we meet people where they are and meet the needs of the audience they're intended to inform. We're going to be looking at open communication, public notification and involvement. Really doing effective public meetings and hearings. Once again, meeting people where they are and their needs, and adapt our methods of communication to community needs. Special populations, whether that is Hispanic community or large Bosnian community, what type of language needs are there when we communicate to different audience? So really just looking at all of those things, in terms of engagement. We also want to look at program integration. So program assessment, looking at everything that we do, looking at our decision points. Where can we really integrate environmental justice as we go through? How do we implement that? And, we have permitting programs. We have those corrective action programs. I think Dr. Henry mentioned, having people at the table when we make remediation decisions. And of course, brownfields, regulation development, funding and grants. Do we need a brownfield criteria in our funding applications as a decision-making tool? And planning. And I will say, and even in our proactive programs. After this, I'll be talking about Kentucky Excel, which is our environmental leadership program. How do we challenge our members to, take on environmental justice activities to really, or projects to help those movements and communities. And then there's internal and external training. Once again, training our staff on environmental justice. What does that mean? How does your job, what is what you do, how does it impact people out across the state and in our communities? Teaching about risk communications. How do you effectively communicate risk? And then program-specific training. But then there's also the external audiences. We have a lot of tools. We need to do a better job of teaching people how to access and use the information that we put out there. And then we need to teach people about the permitting process and how do you get actively involved in that? How do you read a permit? How do you offer comments on a permit? So there's all sorts of opportunities for us to better increase that engagement and increase understanding between our audiences. And of course, as before mentioned, there's some great tools out there for us to use as regulators when we're talking about assessing environmental justice and what it means in these communities. So there's EJ Screen, which she mentioned. Of course, there's going to be enhancements. It's already a great tool. We have our toxic release inventory, community right to know, and then Kentucky has something called Enviro Health Link, which is a lot of our environmental health indicators. So there's lots to be done within EEC and DEP, and we're going to be looking at all of our programs, looking how we can educate staff and how to really get people involved and get our employees involved in that environmental justice framework. So I hope a year out we have some really, really great things to talk about in this. I'm excited, and I think this is something that can have great impacts for the citizens of the Commonwealth who bear the undue burden of a lot of the environmental decisions that have been made over the years. So with that, there's my contact information. Should you have any questions after this, please feel free to contact me. So thank you very much.
Thank you so much, Amanda. We really appreciate it. Our next panelist is Donovan Taylor. He has completed a Juris Doctorate from the University of Kentucky College of Law and has management experience in business and tax strategies, law and legal practice, and community organizing and development. He currently serves as the manager of the Plan Room, a nonprofit business accelerator focusing on capacity building for minority-owned contractors, subcontractors, architects, design firms, and suppliers in the construction industry. Donovan works with the Chickasaw Neighborhood Federation, Rubbertown Emergency Act, REACT, and the West Louisville County Community Task Force to address area pollution concerns. Thank you so much for joining us, Donovan.
Hello, thank you. Good afternoon, and thanks for having me today. And thanks to our previous panelists as well for our institutional on planetary impact of pollution and our institutional activity. I'm going to bring you home to the neighborhood and neighborhood activity as it relates to environmental justice and pollution. I am a resident and native of the Chickasaw neighborhood, which is located in Western Louisville, which is a unique and beautiful neighborhood. I don't know what's going on. Chickasaw was established in 1922 after the establishment of the Chickasaw Park that was designated for Blacks in the city of Louisville. Chickasaw is a neighborhood made of 26 different subdivisions. I don't know what's going on. And our boundaries are the Ohio River to the west, West Broadway to the north, 34th Street to the east, and on the south is Miles Park, the industrial park. Some of the advocacy and accomplishment of the Chickasaw neighborhood is the vacant and abandoned property improvements, Chickasaw Park improvements, and housing and quality of life preservation. don't know why it keeps going back to that. Chickasaw is a fence line neighborhood, and that means that we're a neighborhood that's located near a dangerous industrial and commercial facilities that put residents at risk for daily toxic pollution, chemical releases, and exposure. Chickasaw neighborhood is located near the Rubbertown Industrial Park in western Louisville. Fence line areas are disproportionately Black, Latino, and individuals living in poverty. Fence line areas are more heavily impacted by pollution due to low access to healthy food and other environmental factors. Cancer risks are higher for residents living in fence line neighborhoods, which is a major concern for us in Chickasaw. Rubbertown Industrial Park is an industrial area with companies that are producing a variety of toxic chemicals and materials. For decades, West Louisville and nearby residents have complained of the quality of life and health problems attributed to Rubbertown. I just remember as growing up in West Louisville, and definitely there was horrible foul odors that were being emitted from Rubbertown that has recently been addressed. However, the residents are still concerned about the pollution issues. I have to keep messing up. The environmental impacts of neighborhoods, and particularly Louisville, living in and nearby dangerous facilities. In Louisville, 60% of our residents live within 3 miles of dangerous facilities. When it comes to our Black and poor populations, 92% of our residents live near fence line areas. Louisville ranks top on schools and medical facilities located within fence line areas. And high-risk chemical and commercial facilities threaten resident health, quality of life, and even neighborhood culture. And those are the issues that we have here in West Louisville and in Chickasaw as it relates to Rubbertown and environmental pollution and the quality of life. In particular, we have a park that basically borders the Rubbertown Industrial Park, and that impacts the ability to actually live, work, and play within the neighborhood based on the impacts of the pollution and exposure to pollutions. The fence line neighborhood activism and advocacy. For decades, resident organizations such as Rubbertown Emergency Action and the West Jefferson County Community Task Force have advocated for more action and controls in areas of air emissions and pollution. Definitely want to recognize Ebony Cochran, who is the lead at the Rubbertown Emergency Action Group. She has been a great benefit to our Louisville community on addressing area pollution, as well as Arnita Gatson with the West Jefferson County Community Task Force. Due to basically strong community action, in 2005, the city of Louisville ratified this Strategic Toxic Air Reduction Program, which is known as STAR, as an effort to reduce toxic air contaminants in the community. This is kind of a very innovative and unique program that is relevant to Louisville on addressing environmental pollutions in the community, and has been a great benefit on improving some part of our air quality. In 2018, REACT collaborated with 8 other U.S. communities to work together through the Environmental Justice Health Alliance for Chemical Reform to research solutions for fence line areas. And what do you know, we've just been very active on addressing this and our quality of life and just, how we live and our health impacts in the city of Louisville. And when it comes to the west of Louisville, we have a lower life expectancy as it relates to individuals in other parts of the county. And so this is definitely an issue that we give great attention to. And one of our key components is finding solutions and advocating for solutions for our environmental pollution matters. And some of the solutions that we kind of push forward for the community is that require that these industrial facilities share information on hazards and emergency response plans and solutions with workers and frontline communities. When we're worried about and considering how the impact of the quality of life of these industries have on residents, we also look at and very concerned about the workers who also come back to the community, and these pollutions may impact their families. So definitely this effort is very collaborative on addressing all aspects of how these industrial pollutions impact our communities. Strengthen and enforce health and safety guidelines is a strong component that we advocate on the community level. Prohibit new and expanded facilities near homes and schools. And as previously would address about reading and understanding permits, that's something that we're working through in our community of really getting a notice of when those permits will come out and how neighborhood groups and individuals can respond to permits for new facilities and expanded facilities nearby our communities. And so that's something that we are definitely concerned about. Require facilities to continuously monitor, report, and reduce emissions pollutions, as well as require facilities to use and store chemical and materials to adopt safer processes whenever possible. And when it comes to the Chickasaw community, we are a small but aging community. And when it comes to addressing being so closely located near Rubber Town and these industrial and chemical plants, one of the issues, the possible explosion or disaster that may result at these particular plants and how the community can respond. And we definitely are pressing that the city and state put forth a evacuation plan for the neighborhood just in case of that particular situation happens. As we was addressed earlier about shelter in place, oftentimes when we're dealing with chemical exposure, one of the things that they kind of encourage the residents to do if there's an issue is to shelter in place. However, when you consider in West Louisville in the West Louisville homes, which are many of these homes are aging and old homes that are porous, and so therefore actually a lot of the residents are concerned that by just staying in the home, does that really reduce my exposure to toxic contaminants or maybe in the air? And so if there's another solution that's possible of actually not sheltering in place, but actually evacuating from the area, and meaning that many of our residents are elderly, many of our residents do not have transportation. There needs to be a concerted plan to put in place, if it's necessary, to evacuate residents from these fence line communities when there is a major disaster that may occur. And because I think if I can think back, it was around in 2011 that one of the chemical plants at Rubber Town actually had an explosion that resulted in the death of 2 of his workers and serious injury to another 2 workers. And the community was very concerned on what will that explosion impact on the community. We were told that the impact would be minor, and then the community of being trusting of the information that's being shared by these companies and these public agencies. And so just working together with the community and engaging with the community to build trust, to come up with better solutions, and to better address environmental pollution overall. When it comes to that, when we in neighborhoods, we're not looking at quality of air and our quality of water, but also the quality of our soil as well. And many of our urban communities and definitely our low income communities, there's a press for better food access, but an issue with encouraging gardening within these communities is the soil, and whether the soil is contaminated and whether gardening in these communities with this soil is a viable option to improve their health. And so overall, the Chickasaw, our strong community, we have some great advocates, but our work is collaborative not only with other neighborhood groups, but community groups that are addressing this particular issue. This is a community-wide issue that requires all of us to be involved. And we definitely, as a community group, look to partner with our educational institutions that can provide us with the resources and the information needed for us to have a better stance and be able to advocate for better solutions for our communities. The next slide just provides you with some resources on activities about environmental justice in Louisville, and particularly in the Chickasaw neighborhood, and activities involving REACT and the West Jefferson County Community Task Force. And with that basically concludes our presentation regarding environmental justice and impacts for the Chickasaw neighborhood. And we definitely welcome any questions or concerns that you guys have that I can address.
Thank you so much, Donovan, for joining us this afternoon. As our listeners have listened to our panelists, again, please put your questions in the Q&A. Your talks have all highlighted, so this is for all of our panelists, all three of our panelists this afternoon. Your talks have all highlighted the importance of making environmental health disparities a top priority for national, state, and local agencies. I want to first thank you for the work that each of you are doing. Thank you so much. A question. I'm sure that many of our audience would want to join in the efforts of addressing these disparities. What suggestions do you have for our audience and how they can get involved?
Well,
if I may jump.
Okay.
Go ahead. I'll yield.
Go ahead, Heather.
Sure. There was a document that should be available in the resources, and that has a lot of funding opportunities, announcements, podcasts to learn about more research that's ongoing. And then there's also a request for information. So these are great ways to get involved and inform what's happening, at least on a national level. And then, of course, always encourage being aware of legislation that's going through, but whether it's in the national, state, or even in your local community, and making it known, how important these environmental health disparities and environmental justice issues and initiatives are to you. Thanks.
If I may add in, I would just encourage individuals, definitely lay individuals, to just get involved in your neighborhood or community groups that are addressing environmental issues. They definitely would need your help, and that's just definitely a collective way to addressing it, and definitely, and creating partnerships with other agencies, and as well as, as far as here at UK, is working together on community action and more importantly, collaborating to put forth and advance policy changes that can have a positive and beneficial impact on our communities.
And I want to, echo that, we always appreciate public input when it comes to regulation and policies, because, sometimes we don't necessarily know all the caveats unless people make us aware. So we appreciate public input. So hopefully we'll be making that easier for folks to, identify and to provide comment, and of course, getting involved at the grassroots level in your community and really getting to know your community needs is always important. And often, we can, help people connect to resources if we can work with them on various and sundry things. And I will say that, we have an environmental leadership program where we have people do voluntary projects for environmental improvement. So we'd love to work with some local grassroots folks and maybe connect them with, entities looking to do good in their communities too. So it's a match where, maybe we can get someone to pay for raised beds for a community garden, where the soil doesn't, where the soil becomes a non-issue. So I would love to maybe try to find ways to make that happen too. So I think if we can sort of communicate and make those connections, a lot of great things can happen. So.
We have another question.
Well, we welcome.
Go ahead. So we have another
No, I was
question.
going to say,
Go ahead, Donovan. Sorry.
no problem. I'll just say we're welcome to partner with you guys at UK here in West Louisville. So definitely reach out.
Good deal.
Thank you so much. And one question is specific for Heather. How will President Biden's climate plan impact the research priorities at NIEHS? I'm not sure if you...
Well, certainly very directly. I mean, when a president has an agenda that, calls for, for example, the Justice 40 calls for reinvestment in communities that are impacted by climate change. So that means that federal investment will need to be directed, and we'll need to pay attention to make sure that we're reaching that 40% level. So that's one example. Sometimes when legislation like this goes through, it means the creation of new funds. So it leads to enhancement of opportunities like the ones that I described previously. And so that is too early at this point to know if that's going to be the case, but that's certainly another way that it would make those priorities more known to NIEHS. And then the other aspect I mentioned is the White House Environmental Justice Advisory Committee. When committees like that form and look across the government at opportunities, they also identify gaps in research, and that is used by our institute to develop statements about the types of work that we feel is necessary, and those get advertised through notice of intent to publish or other means that come before requests for applications might go out. Thanks for that question.
Thank you so much, Heather. Another question was, can the study of the effects of strip mining and mountaintop removal mining on the health of nearby communities now be completed? It was shelved during the last administration.
Well, what I can say is that the United States Environmental Protection Agency has developed a new mountain and minerals division. I'm not using the right name there, but I do know that the impacts of mining is something that is very much front and center on this new office within the EPA. So I don't know that there were reasons, within the National Institute of Environmental Health Sciences, and I think it's true for several other agencies doing funding. A lot of times the work is proposed by the what the questioner described as something that does sound like it falls within the NIEHS mission, and talking with a program officer might be a way to find out how the work that they are interested in doing could be funded, because I'm not aware of any restrictions against that, just that there might not have been any specific announcements going out about it. Thanks.
Thank you again, Heather. And I want to take these last few moments to thank our audience and again thank our panelists. Health disparities and health equity work across our neighborhoods and how the environment impacts us all is a extreme top priority. And so thank you so much for all of your hard work. And I hope our panelists, our audience was moved to think about action and how we can all work together to impact change. Thank you. Erin, do you have any closing remarks?
Yes, thank you. Getting my webcam back on. That was remarkable. I'm just amazed at the great, excellent work that is being done, and still the need that is still there, that we still need to take up the torch and do work. So thank you, everyone. I want to let everyone now take a break. We have a much needed personal comfort break. We will begin again at 2:05. We have an incredible lineup of breakout sessions featuring cutting edge research, environmental action that you can get involved now with water quality and water monitoring. Enviro Atlas is here with EPA. And then please join us following the breakout session for a final wrap up. We look forward to seeing you all back in the breakouts. Thank you. We'll take 5-6 minutes. See you then.